Well, welcome everybody. Good afternoon and happy Friday. It's 12 o'clock, so we're going to get started. We know that sometimes people need a few minutes to transition from meetings, so we'll kind of run through some of the background information, and we know folks will be trickling in. So we are very happy to have you join us for the 5th webinar in our series, Partnering with Schools. Today we are hearing about strategies for making the case for school mental health. So a quick thank you to our sponsor, the Substance Abuse and Mental Health Services Administration, and then of course the disclaimers that we always need to share. So a little bit about today's agenda. Today we're going to be talking about social marketing and what that term means. We'll discuss who we may be trying to make our case to about the benefits of school mental health, and then how we can share our messages to that audience. We'll also talk about what we can do to make the argument for sustaining our partnerships. Then we are fortunate to have David Baker from Klaras Center for Families with us to share information about their efforts to build and sustain their school-based mental health services and the lessons that they have learned along the way. And we'll wrap up our hour together with an opportunity for questions and, of course, the opportunity to access your CEUs and to complete a survey. So please take a second to type your name and organization into the chat box. This will serve as our sign-in record, so we really appreciate when people do that for us. Thank you, Kaylee, for starting us off. Okay, so again, a big thank you to David Baker for joining me today to share his wisdom and experiences. I'm going to kick it off, but I know we all can't wait to hear from David. Okay, so we're going to start off with the concept of social marketing. Social marketing builds on the concept of marketing, what we think about traditionally as marketing. So how do we sell products, goods, and services, but focuses instead on changing behaviors. When we engage in social marketing, we are thinking about the most effective strategies to lead people to make a change in their behaviors. Sometimes this gets confusing with social media, which is really more of a platform for how we may choose to do some of our marketing work, but social marketing is really about changing behaviors. So let me give you an example. Think about the challenge that we may face with men experiencing mental health problems, but feeling uncomfortable acknowledging these issues and accessing treatment. We want to change attitudes and reduce the stigma around mental health problems experienced by men, and then increase the behavior of seeking treatment or help from friends and family. So an example of a social marketing campaign in this case would be what you see with man therapy. Some of you may have heard of this before. Some of you may want to go look it up afterwards on the internet. But it uses humor and a silly character, Dr. Rich Mahogany, to normalize the experience of having mental health challenges and provide a more masculine take on treatment. And so that's an example of a social marketing campaign, a more formal campaign, that's aiming to change these attitudes, behaviors, and create buy-in. For us, we're interested in creating buy-in about the value of providing mental health supports in schools. Perhaps change some negative attitudes that folks may have about that. So for example, that it isn't a school's role, and change behaviors like working towards an MOU, outlining a collaboration, or allowing you as a provider space to provide services on campus, or even providing funding to support those services that can't be reimbursed by insurance. So one of the most important keys as we think about social marketing, so after we've identified our goals or the attitude change that we are seeking, is to think about our audience or audiences. We want to make sure that as we are developing our messages, that we match those to our specific audience. So now it's time for our audience participation component. You all have started off by typing a little bit into the Zoom chat. You also have the opportunity of going into the participant list and unmuting yourself if you would like to just chime in. But I want to ask the question, given our social marketing goals, who are our audience? Who is our audience, or who are our audiences? So go ahead and either chat that or shout it out as you think about an audience. All right, so we've got the suggestion of teachers, parents, school staff, some different audiences there. Anybody else have any they want to add? School administration, right? So our leadership at schools, PTA, very good. There's another potential audience. Okay, great. So exactly. So as we think about our audience, we've got school boards, school administrators, we've got our educators, certainly our teachers are an audience, our students and our youth are audience, school administrators, leadership, including district administrators, and certainly parents. Other folks brought up some organizations around those audiences. So the Parent Teachers Association, the student groups themselves are audiences. So excellent. So we need to make our case to those groups, but we may have, let's, for example, say we have buy-in from administrators, but teachers are not seeing the value or are not referring youth, or are deciding they don't want to partner with you as a provider to try specific classroom supports. So you may need to create buy-in with those specific audiences. You may also need to create buy-in with parents and community members. They may need to see the value in having these services within the school. And of course, we can't forget about students. You may be planning on how you message to youth about the value of having school services or taking part in school services on campus. So let's take a look at some potential messages for each of these audiences. And these are just ideas. You really need to spend some time understanding your unique audience and the messages that will be most effective for them. So teachers within a particular school may have different things that are important to them or different concerns. And so you need to spend a time really understanding that particular audience. But let's look at some potential ideas. So school administrators. So for our school administrators, we might want to let them know certainly that mental illness is common, but it also is likely to impact graduation rates. And that approximately 50% of students aged 14 and older, so our high school students with mental illness, drop out of high school. So mental health treatment and supports can help change this outcome. We also want to think about the importance of attendance to school administrators. This is sometimes how their funding comes to them. So we know that accessing mental health services at schools increases attendance rate. As well, that over half of school absences for children who do have mental health challenges are due to that mental disorder itself and treatment for that. And certainly one of the most traumatic events that can happen to a school community and a community at large is to have a student or a staff member die by suicide. And so we might want our administrators to realize that more than 1 in 10 of high school students will attempt suicide in the next 12 months. And we know that based on our state's youth risk behavior data. And so having a strong suicide prevention plan and trained staff, as well as access to effective services and crisis services, helps save lives. Many of our schools have new requirements around suicide prevention planning. And so being able to describe the services and coordinate with you all around crisis plans can help them address some of these planning needs. Some additional things for school administrators. Addressing mental health challenges can certainly have an impact on important academic achievement. So this is a particular impact of having school-based mental health services. It can help improve standardized testing scores. And there's research data to show that. And next, we know that similarly, having school mental health services can help with discipline and suspensions and expulsions. So children who are suspended or expelled are certainly not in class participating in learning, and they're also at an increased risk of justice involvement. So school-based mental health services can help reduce discipline referrals, suspensions, and expulsions. So you'll notice in these messages we're targeting things that are particularly important to school administrators, elements of their performance improvement plans that they're working on, and ways in which mental health may impact the funding of their, the rates that they receive for students in the classrooms, as well as those key performance items that are so important to them. But what about teachers? Teachers may not necessarily be focused on the same things that administrators are focused on. So an element that may be really helpful for teachers to know, certainly they're probably aware that many different types of mental health challenges can impact the way that a student focuses in the classroom. Certainly things like attentional problems and ADHD is something that quickly comes to mind. But certainly we know that other challenges such as anxiety, depression, and traumatic stress has significant impacts on children's ability to focus in the classroom as well. And so addressing these issues early can really help improve academic achievement. We know that having school mental health resources on campus can help improve the school's climate and create a better work environment for the teacher. So not only about what is helpful for the student, but also can really make the school a better workplace for our teachers. Can also help reduce job stress and burnout for teachers. I think all of us know teachers and the difficult work that they do, and there's a lot of stress and challenges. And it's not uncommon for teachers to work for a few years and then decide that they want to find other ways of contributing and other employment opportunities. And so having mental health supports on campus can make a difference in that trajectory. And then school mental health supports also can just give teachers more time back for instruction, both in terms of having less disruptions in class, but also in having students have fewer absences outside of the class and less office referrals. So if those students are in their seats for a longer period of time, they have more opportunity to receive the teaching that the teachers are doing. What about our parents and community members? They may have other things that are particularly of interest to them about having campus-based services. We might want to share with them about how common it is for behavioral and emotional problems to happen, and that many of those disorders will start in childhood, and that having school-based mental health services is going to help identify those problems earlier, get access to services earlier before they become really bigger problems, both for parents as well as for the community at large. We also know that one of the things that is common is that many people don't receive treatment for many years after symptoms begin. And one of the benefits of having school-based services is it helps families access those services easier, and they spend less time out of school and out of work. So there's a lot of benefits to families around this. And we also know that many children will never receive the treatment that they need. That's a common finding. And that most of those families that do access mental health services do that through their schools. So if we don't have access within our schools, that means those kids will not receive services generally in the community. And what about students? Students, of course, have their own issues and the own things that they're that they are interested in. So for students, having mental health services available in schools may make it really much easier for them to access those services. That can mean less time that they spend in going to services outside of school when they might much rather be doing hobbies, participating in after-school activities, taking part in sports, and so forth. In addition, having somebody on campus allows teachers to learn how best to support students. So if the student is having a particular challenge in a class with, say, paying attention or some external stressors within that class, having that school-based campus provider can really help teachers be fully accommodating, hopefully, for some of the coping strategies that are developed. And then certainly we know that for students, issues like stress and sadness and relationship problems are common, and so having that access to somebody that they can turn to and talk to about those issues right on campus, somebody that they may already know and have a relationship, can be a real powerful motivator. But we also know there's going to be some challenging perceptions out there. And I would suspect that many of you guys have heard some of these sort of messages or related messages as you've talked about school mental health. Teachers already have too much to do. This can't be another thing on top of all of the educational requirements that they have. Or that behavior and emotional issues really should be left to parents. The school doesn't have any business that. Or schools are really not about, are really just about education. That's what their focus is. It's not about mental health care. Those are all messages that we've heard. They're common in some form or another. And as we think about how we want to message to schools, we need to plan for how we're going to address some of those issues. I'm wondering if anybody who's participating on the call would be willing to take one of these messages and share with us how you have tried to respond. What is the messages you've tried to respond as you've experienced some of these challenges? And if you can, if you want to share, I'm hoping that you will, all you have to do is hit the unmute button on your icon and you'll be able to share with us. Got a quiet group. Okay, I'll give you a suggestion, and we may hit David up as we hit questions and answers to see about some of his ideas too. But let's take the first one. I might respond by saying, you are so right. Teachers do have a lot on their plates. But if teachers have more tools to provide supports in the classroom when children have emotional or behavioral problems, and they have mental health professionals on campus who can help provide additional supports to those students in need, there's going to be more time for teaching, and the students are going to get more out of that. So again, just trying to think about how we think about kind of the concerns that those audiences bring to this discussion and how we're going to try and address some of those. So I want to share with you a little bit about an organization. I'm going to share my geekiness here with you because this is an organization that really intrigues me. It's called the Frameworks Institute, and it specializes in studying how best to message social issues to the public. They research the faulty and unhelpful beliefs that people have in the community, and then they study how to increase people's understanding of an issue, and then how to motivate them to do something about it. They have addressed a wide variety of social issues. Their website is fascinating, and I really encourage you to go explore it if you're interested. I wanted to share with you their findings about the best ways to talk about children's mental health. so that you could understand some of their principles. I'm going to, a little bit later in the webinar, I'll add some links to the chat box so you can go find their Children's Mental Health Toolbox if you're interested in looking further at some of those resources. So first, I want you to kind of clear your mind and step into the role of a community member. So take off your mental health provider, your kind of knowledge about children's mental health, and just be kind of the traditional community member who may not have that background. And then listen as if I'm a presenter at a local meeting trying to talk about children's mental health within our community. Okay, ready? Okay. So child well-being is important for our town's development and the strength of our economy. Young children with strong mental health are prepared and equipped to develop important skills and capacities that begin in early childhood. These children then become the basis of a prosperous and sustainable society, contributing to things like good school achievement, solid workforce skills, and then being good, strong citizens. When we make sure of the healthy development of the next generation, they'll pay that back through productivity and responsible citizenship. Scientists say that children's mental health affects how they socialize, how they learn, and how well they meet their potential. One way to think about children's mental health is that it's like the levelness of a piece of furniture, say a table. The levelness of a table is what makes it usable. It makes it able to function. Just like the mental health of a child is what enables him or her to function and do many different things. Now, some children's brains develop on floors that are level. This is like saying that children have healthy and supportive relationships, and they have access to things like good nutrition and health care. But for other children, their brains develop more on a sloped or slanted floors. This means they're exposed to abuse and violence, have unreliable or unsupported relationships, and don't have access to key programs and resources. Remember that tables can't make themselves level. They need attention from experts who understand levelness and stability and who can work on the table, maybe the floor, or even both. We know that it's important to work on the floors and the tables early because little wobbles early on tend to become big wobbles later. So in general, a child's mental health, it's like the stability and levelness of a table. So in order to make sure that our town continues to be prosperous with a strong workforce, we need to make sure that children are able to access mental health services in schools. We can address those wobbles early so that children's brains can develop on a stable surface and they can reach their full potential. End message. Okay, so here are some of the key frameworks, some key findings from the Frameworks Institute and ways that they suggest messaging around children's mental health based on the findings that they had. So first is they suggest that you orient to values of prosperity or ingenuity. And they found that when folks oriented to those values, thinking about kind of the importance of prosperity in our community or developing new and innovative things within our community, that puts people in the right mind to hear about the importance of children's mental health. So then you shift and you introduce the issue, children's mental health, and you provide a simplifying model. And the model that they found was most effective was to talk about the leveling of a table. Okay, so you heard me do that, to talk about how children's mental health is like a table and the levelness of the table. And then they found that it's helpful to talk about brain architecture, so how children develop and the importance of children's mental health as a part of the development of the brain, as well as talking about toxic stress, so the things that can disrupt brain architecture as a part of that. And then to shift into your policy solution. Okay, so in our case, it's about expanding school mental health services. Okay, So I wanted to kind of share that with you all. And I will put in information in the chat box so that you can see it as a suggestion, a research-based suggestion about one of the ways you may want to talk about children's mental health with key audiences. So just a couple more slides and we're going to shift over quickly to David. But we also know we can't forget that even after we have initial buy-in from schools and from our community partners, we have to continue to market to our audiences in order to sustain this work. So we need to be thinking about how we're measuring directly within our schools and our communities the impact of the work that's being done. So certainly documenting impact is important about describing kind of those successes and also the challenges. And then of course it's important about informing continuous quality improvement, because if our services are not working and are not getting the outcomes that we see in the research, we want to address that. But they're also very important for advocating for continuing to do the work, to grow the work, or to change the work. And without being able to have local evidence of success, we're unlikely to be able to sustain the work. So here's one example of a school that did that. They actually built within one of their online systems an opportunity to track the outcomes of their work. And they were able to show that the services that they were providing were targeting the right kids. They were kids with high levels of disciplinary events, with suspensions and chronic absences. So those kids that are keeping administrators up at night, as well as those experiencing poverty. And then from that, they were able to show that the services, the kids that were receiving mental health services, were actually even impacting language arts and math. And so those children were no longer needing special services for language arts and math. All right, so a couple of helpful tips. You want to be thinking about measuring those things that are likely to be impacted by the school mental health services. So things like grades, attendance, test scores, office referrals, suspensions and expulsions, crisis incidents, school climate, teacher well-being, etc. Those things that are readily available or can be collected fairly easily. Those that are most important to your audiences, as we thought about messaging, and then those that can be shared both within the school team for quality improvement, but then beyond in the community. All right, so I am excited to now shift over and let you hear about some real-world work from David Baker at Klaras Center for Families. David, take us away.
Thank you, Molly. Thanks for having me. Thank you all for being on. I hope that you're not as quiet as you were when Molly had some questions. It'd be nice at the end to talk about some things. So I supervise our school-based mental health program through the Klaras Center for Families at Heart of Texas Region MHMR. We've been doing this now going on 4 years, and so it's been exciting to do that. And then Joy's asking, what does HOTR stand for? It stands for Heart of Texas Region, and then we're in MHMR, so Heart of Texas Region MHMR. And the Klaras Center is our child and adolescent division of the Heart of Texas Region MHMR. So what we did was, several years ago, myself and a case manager were asked to provide school-based mental health services on an elementary school campus in one of our school districts, that in one of the campuses that had the lowest socioeconomic status. The kids were not doing well in school. They were not doing well in standardized testing. And so the principal was pretty forward-thinking and asked about the opportunity to have school-based mental health resources. And so that's where we started, at an elementary school. And so while we are doing this on this one single campus, our agency was a part of what we call a system of care. If you are familiar with the system of care, or if not, basically we wanted to get the 4 pillars together. So the 4 systems that traditionally work with children, which would be the school, Child Protective Services, we as the mental health providers, and juvenile justice together at the same table and discuss the services that we provide to these children and families. How are those services linked together? How are those services overlap? And then also, what bureaucracies keep us from communicating with each other, so that we're either not stepping on each other's toes or we're not overlapping services unnecessarily. And so we were able to bring together these 4 pillars of service providers in order to get at the same table. And initially we called it the Heart of Texas System of Care, but it later transitioned to Our Community, Our Future. Molly, if you'll forward. Yeah, so a system of care, and I just want to highlight a few phrases out of here. It's a coordinated network that builds meaningful partnerships with families and youth and addresses their cultural and linguistic needs in order to help them function better at home, in school, in the community, and throughout life. And it really is a systems approach, as the title of a system of care talks about. So we want to start that. Some core values were that we wanted to provide services that were family-driven, youth-guided, and taking into consideration the strengths and needs of the child and family, which would then determine what types of services and what mix of services and supports were provided. We wanted that to be community-based, with management resting within a supportive, adaptive infrastructure. And then we wanted it to be culturally and linguistically competent, meaning we wanted to take into consideration each family child's individual culture and then the culture around them. And then also linguistically, meaning language barriers. What barriers can we overcome due to linguistics? And we often know that that has such a big impact. Part of Texas Region MHMR, we serve these 6 counties that you see here on your map: Bosque County, Hill County, Limestone, Freestone, Falls, and McLennan. McLennan is our most populous county, and it is the kind of the hub of all of the services that we provide. And we're working with children, youth, and young adults 3 to 22 in that area. And some of the partners of this system of care include currently 10 school districts that you'll see there, with Waco ISD and Midway ISD being the largest. We have some that are very rural, like Whitney and Hillsboro. And so our school districts range from 3A with maybe several hundred students up to 6A with thousands of students in their school districts who are partnering with us. We also partner with our Region Service Center, our Education Service Center, Region 12, as well as 2 of the juvenile probation offices, Prosper Waco, a youth transition, youth runaway homeless drop-in center through the Waco ISD. And so we've got a lot of great partners sitting down at the table. Priority, we wanted to look at, we have a long list of priorities, but, and I was going to talk about, so in a further slide, I believe, but we applied for a grant through SAMHSA, and these were the priorities of this grant. And the grant is called Closing the Gaps Grant. And so these were some of the grant gaps. These were some of the gaps that we noticed that needed to be filled. And so these were priorities for us. And in the middle there, you can see school-based mental health services. Another one that we're very proud of that we finally have up and running is we also have a youth crisis center. And so that is actually a 24-hour facility where we can help children, adolescents 3 to 17 in a crisis, hopefully help them from having to go into the hospital or a juvenile detention center. So that's really neat too. So you can see the next one. So we provide these services in school-based mental health. I like to consider them wraparound services. There is a technical term of wraparound, but I like to use that term with my audiences that we talked about earlier, so that they can understand that we're really there to help the entire system, the child and the family, work with the schools, work with juvenile justice, child protective services, and any other systems that they're involved with, even if that's outside of those, including primary care physicians or other mental health providers. But we provide case management, individual, group, and family counseling, trauma-informed care services, crisis services, parent consultations, parent education, school advocacy, psychiatric assessment, and family partner support. And let me talk about that family partner. Family partner is a person who has either raised or currently raising children or adolescents with severe mental, emotional, or behavioral health issues. So they're really a peer provider for our current caregivers. And so that's really been a great support for them. One of the questions that Molly had was, what do we do when teachers or educators say that the behavioral health needs of their students are on the parents, that the parents should be the ones that have to deal with that? Often my response to that is we work with the entire system. And so oftentimes that mental health disorder, that behavioral health, that can be one of two reasons. It can be that it's a biology and that child cannot control themselves. And so we can help families with that. Or it may be that the parents, the caregivers, the child do not have the internal resources to deal with that. And so we can step in where the schools cannot. For instance, we work year round. We work through spring break. We work through Christmas break. We work through summer break. We make home visits. We have case management and therapists that will work with the entire family system, whereas that's often so much more difficult for a school to do that may have 300 kids on their campus. So case management, and what we're doing there is we're exploring ways to help the child succeed through improving parent-child relationships, making referrals for community resources, understanding the developmental stages of childhood, supplying reference materials or information to help understand special needs of the child, and skills training to facilitate pro-social skills and behavioral expectations. We not only provide referrals, but we also do some hand-holding. So if a family is in need of help applying for Medicaid or food stamps, or going to visit the primary care physician and discussing the symptoms that their child is having and relating that back, we also have registered nurses who can help with that to help mediate the influence of mental health, behavioral health on a child's physical health, or vice versa, a child's physical health on their mental and emotional health. And the next slide is about counseling. Again, we provide primarily CBT, which is the state-approved modality. But we also have trauma-focused counseling, play therapy, anger control and emotional regulation, pro-social behavior skills, adjustment, challenges, peer relations, and crisis services in our counseling. And then we can move on. So I mentioned earlier that we began working in one elementary, and that elementary was J.H. Hines, and we began working there in 2016. And the principal there thought that it would benefit us to complement what he was already trying to do through his own staff. He had social emotional learning coaches, he had behavior staff, he had aides, but again, he had a campus with 300 plus children on that campus, and he understood that some of those children needed more intense services than his school could provide. And so he struck up a deal with Klaras Center and to include putting a licensed professional counselor and a qualified mental health professional or case manager on his campus, and said, we would like for you to work with our 30 most intense children and families. And we did that over the course of actually one semester. We actually got started late, but we did that. And just a little bit of information, 15 out of the 24 children that we worked with in school-based mental health saw a reduction in behavior reports, with 44% of those having a reduction in total number of behavior reports. So 64.5% of those children that we worked with saw a reduction in behavior reports, with the total number of behavior reports having a 44% reduction, which was pretty remarkable in that work. And then, so while we're working on J.H. Hines, our system of care that I talked about, it's okay, Molly, I was was applying for this Closing the Gaps grant in order to then expand to other schools. And so what we did was, once we were awarded that grant, we were then able to reach out to some other schools and get some buy-in and see if there were any other school districts that were involved. And through that system of care, we had several school administrators or school staff already sitting at the table who were very interested in what we were doing. And so through that, we had two at-risk counselors for two of our bigger school districts say, hey, even with us not doing the administrative part of school counseling, we're still having a difficult time. And so that opened the door to us getting on to 4 campuses initially, 4 school districts initially, which included a rural school in Hillsborough. It included La Vega ISD, Midway ISD, China Spring ISD, and then Waco ISD. And so that was really awesome that first year we were able to be on 4 different school districts. And we did that with a case manager and an LPC in each of those districts, but some of those looked different. Most of those schools wanted to utilize us throughout the district, which meant we were on multiple campuses, whereas the inaugural tandem that we had was on 1 campus. So I wanted to share a little bit of data that we collected. So that's the next slide there, Molly. So in 2018, we started kind of reviewing some data on those 4 school districts that we were in. Brook Avenue Elementary is one of the schools that we have been on that is at risk of being shut down by TEA. They're on the IR list, if anybody knows what that means. But with the 30 kids that we worked with there, we showed a 48% reduction in number of disciplinary referrals, which means that there's more class time without disruption, which leads to more learning opportunities, improved self-esteem, and better grades and overall success. Also, that school at the time had a high rate of suspension of kids. And so if we could keep them from even entering into the disciplinary referral, then we keep them in school. We also collected data through what we call our Child and Adolescent Needs and Strengths Assessment, the CANS. And through that data, it shows that 80% of those students served have improved or maintained levels of impulsivity or hyperactivity. 82% have demonstrated improvement or no increase in depressive symptoms. 76% demonstrated improvement or no increase in anxiety. 79% have shown improvement or stability in anger control. And 79% have improved or maintained levels of school functioning, which includes school behavior, attendance, and relationship with teachers. You can, yeah. In addition to the CANS, students served in school-based mental health complete SAMHSA endorsed survey measures, which are given at intake. They're given every 6 months and they're given at discharge. One of the primary surveys, known as the Youth Empowerment Scale, is completed by youth 11 years and older. And that data revealed statistically significant improvement in students' reported perception of their overall level of functioning and students' perception of their level of influence and participation, meaning that they themselves, the students themselves, believed that they had an improvement in overall functioning, as well as whether or not they had an influence in their own lives or in the lives of others, which is beneficial. And then Molly, I'm going to talk a little bit about the expansion there, if we can. So after the first year with those 4 schools, it was time to expand again. And we were very fortunate that one of the superintendents that we were working with in Lorena, one of our bigger school districts, was very excited about the potential of having school-based mental health services. Not only was he excited, but he was the president of the region superintendents meeting. And so he invited us to come talk to all of the superintendents at their meeting. And through that, one of our school campus superintendents from La Vega, Dr. Shields, she spoke up and spoke about how they have been a part of the process from the beginning, how beneficial it was. And so just word of mouth from one administrator to another is huge in expanding. And so from there, we were in talks with some other school districts, and we had a superintendent say, we'd love to have you in our district, but we need you to reach out to this other district as well. I thought that was kind of odd at the beginning, but he was so excited about it that he knew that this other school district would benefit as well. And so he says, I'm going to call that superintendent. And normally people will call and they'll say, hey, I'm going to call them, and then they get around to it later. But he actually picked up the phone right then and there and called this superintendent. And right then we had 2 school districts on board. And so, like I said before, schools really work closely together. You might not think that, but they really do. Superintendents talk, administrators talk, counselors talk. And so if you can really show improvement in those kids and what it's doing for the overall district or campus, you've got a great foot in the door by word of mouth. So then if we can scroll to 2019, we just finished this school year. We have a contract with the University of Texas, with TimeH, that is collecting data for us and turning it into the SAMHSA grantors for us. And so they ran this information for us. They're doing a great job for us out there. 6 out of 10 of the schools receiving embedded mental health services reported multiple time point attendance data. So we were trying to collect attendance data every 6 weeks, every semester, and for the school year. And they pointed out that all schools have seen at least a modest reduction in absences from the first time point. The importance of that, not only is that if children are in school, they have the greater capacity to learn, but there's also a financial component for each school. The federal government reimburses them a certain amount of dollars per student that is on campus that day. And so that's actually one of the points that you can bring to a school or school district about how you can help improve the overall quality of that district. And that is that hopefully they will receive more funding from the federal government based on increased attendance. Life functioning, youth reported improvement in family and friend relationships, school performance and coping. And then in the arena of mental health, youth report a reduction in feeling nervous, hopeless, depressed, and worthless. Molly, if you'll stay there for just a second. That's important as well, in that we know if children are not emotionally well, they're not going to be prepared to learn. And oftentimes that is missed in an old school version of education, in that in order for a student to be prepared to learn, these other things have to be in place as well. And so it's nice to be able to see improvement in those things. And next, we can go to the next one there, Molly. So the next several slides are kind of anecdotal quotes about what either the schools are saying or the parents are saying. This first slide is what school administrators have said. It says, when I spoke to my principals about it, they were all open for it. We have space for it at the school, right here upstairs. And then she says that, in fact, we had the lead for the school-based program come and do a presentation for us and for the teachers. And so that's one of the ideas when Molly was talking about who our audience is understanding that oftentimes it benefits for us to go out and make a public appeal. The school year is about to start for the 2019-2020 school year, and we're having that discussions with my staff now. Can we be a part of in-services? Can we be a part of trainings? Can we be a part of the great big meeting that they're going to have with all their staff and try to encourage them for a great school year? Can we be a part of that? It's more than just meeting with superintendents or principals, but getting to know the school staff, getting to know the gatekeepers, the men and women who are at the front desk, deciding whether or not we should even enter their campus, or calling kids for us, and just being a part of the school campus. That next quote says, I feel like the therapy and the collaboration with the counselors is working well on the middle school campus and the intermediate campus. High school is more challenging. There are just so many kids on the campus, and the campus counselors have a lot of demand on them. But the therapy, the sessions themselves, from what I understand, are good, and our tandem counselor is confident about the situations with kids. Yeah, I made a note. It's my opinion that the earlier we can start with the child, the better. And some reasons for that are actually mentioned in this quote, is that when you can get to them in elementary or intermediate or middle school, oftentimes their schedules are not as challenging to work with, as well as we have more caregiver involvement with that. Go ahead, Thermal. Y'all have any questions so far? Any thoughts?
So David, we did have a question in the chat box if you'd like to answer this one. So Shannon asked, do most of the students participate in both skills training and therapy, or do they primarily just have one or the other?
We do both. Our Qs, our qualified mental health professionals, have a case management role, but they're also well versed in the skills training curriculum that we're allowed to use, which is a skills training in anger replacement techniques, our seeking safety, our PIA. For those that work for an LMHA, they know what those are, but we have those. And then our therapists are either licensed or working towards licensure. So for those that are licensed, they can actually do CBT or TFCBT. Those who are still working towards licensure, such as our LPC interns or our master's level social workers, they're providing skills training. And did that answer the question?
Shannon said yes.
Yeah, I see it. Okay. Schools, again, I just wanted to include, we don't have to go through all of these because I know we're going to be on a time constraint. But this school educator even talked about our ability to work with Child Protective Services, not only making a report to CPS, but also being a mediator between CPS and the parent, or CPS and the school, or the school and the parent. And then I like this when the teacher says he's improved so much. Once he started working with y'all, he's able to communicate in full sentences, and that's a first for him. And oftentimes, schools may see an inability to speak in full sentences as an education issue, whereas sometimes it's actually an anxiety issue or an inability to able to verbalize what's going on within their chaotic life. And so I think it's a pretty awesome statement there, actually. And then our next slide, what guardians are saying, right? So not only do we need the input and the buy-in from the schools, but we need the guardians, the caregivers' input, and we need their buy-in. This very first one talks about her child hasn't received any calls in almost 3 months, and that at home he's able to handle himself much better. And then the next one talks about how Klaras Center stood by the parent and the kids through all of their challenges, ups and downs. And even though that many others wrote their family off, we were still there. And I think that's huge. And that's big to know that for the families, they know that they have someone in their corner to help. And then the schools know that we're there to help the families as well. That third quote there went from 15 incident reports at the beginning of the school year to 0. And so that is awesome. That's amazing. He's able to focus better in class and at home, and is able to regulate himself so he can get his work done and follow instructions. This child really probably was an issue with ADHD, and it may have been a medication issue, but it sure looks good in our quotations there. And then thank you, Klaras, for working with my kids. Decrease in calls about behavior, and I actually get good reports now. That's big for our families. And oftentimes when I'm talking with school principals, that's one of the points that I'm making, is that oftentimes our caregivers have a negative idea of the schools, and the schools have a negative idea of our parents, because primarily with the 30 most intense kids on their campus, the only communication that is happening is when a child is having a negative behavior or is not doing well. There's little opportunity for the school to recognize positive aspects of that child and family, and there's little opportunity for the family to recognize what a great job the school is doing with their child. And so us being able to mediate that is a huge step forward. And then there's another slide there with some more discussion from parents.
David, we've got about 2 more minutes.
Yeah, no, let's go through that one. One of the things I wanted to talk about was the strengths of school-based mental health. Yeah, go forward. That's just more data about bragging on ourselves, I guess. Strengths of school-based mental health is transportation, reliability, and appointment attendance. So if we're providing those services on the school campus, the parent is not losing time for work, the child's not losing time from school. And so that really makes adherence to treatment much more predictable. And then we can collaborate with the school for behavior and special education, relationship building, legal intervention, not in that we're attorneys, but in that we can help with child protective services. We can refer to attorneys that work with low socioeconomic status clients, and then enhance social and academic adjustments. Some of the barriers that we've seen, if we can go to that next one, is it's difficult to find a confidential space oftentimes in schools, and then getting individual buy-in from campus and staff, and then solidifying the referral process, and then crisis service for non-clients. So those are big. And then looking forward, it would be great if we could use technologies such as Zoom to provide telehealth in schools. That's one area where, as of right now, children still have to leave school in order to see a psychiatrist. So that would be great if we could help in that arena as well. And then the last slide just has some MHMR and OCOF resources, system of care resources there. And then whatever questions y'all might have for me.
Thank you, David. Let's open it up. Folks can again unmute themselves if they'd like to ask David a question.
Molly, I think we've done a good job because there aren't any questions.
I think that may be true. Okay, well, while we're waiting, just a minute or 2 more to see if you guys have any questions. I'm going to be typing in the survey link, and we hope it's really short, just 4 easy questions. We hope that you will fill it out, and we need you to fill it out for you to get your CEUs. It will link you to a CEU form if that's of interest to you. And our next call will, oh, I did not bring the date. I believe it's the 26th of August, I think, on a Friday again at the same time. And we'll have the opportunity to hear from a couple of other local examples of great work, just like David provided. Okay, I did not hear anyone else chime in with a question, so thank you all so much for joining us today. And thank you, David, for sharing such wonderful information, such real-world information about how to help make this work. So we look forward and hope that you will join us again at our next webinar. Bye-bye, everyone. Have a good weekend.
Bye. Thank you, Molly, for having me.